I'm Rose Kent and I'm the General Manager at Accessible Arts and Media, and we're the charity that set up AbleWeb. Came about in 2007. We were in discussion with the Valuing People Partnership Board and other partners around the city that were working with people with learning difficulties and disabilities and disabled people themselves. And because there was an awful lot of changes that were happening within the social care networks, we decided that it would be very useful to have a central resource for information. Firstly about the changes that were happening, but also about the activities and the opportunities that were available to people with learning difficulties and disabilities. And we then at that point started thinking, well, probably the most sensible way to work would be to set up a website, because it could be the sort of thing that anybody can log into, and with a bit of training, people, users themselves, people with learning difficulties, could actually make use of the website. We then started thinking, well, actually, it would be great if those people could be the ones that would actually create and manage the website. So we then went out and fundraised, and luckily got some funding from the Partnership Board, but also from the North Yorkshire Learning Consortium, who helped us to get the money so that we could train the guys up. So we spent a couple of years training our group to run the website and to learn all about it, and that's where AbleWeb came from. The Valuing People Now is a government initiative a few years ago that was set up to give people with learning difficulties and disabilities more choice and more control over their own lives. So we, as a local charity, have been working with a number of other organisations to make sure this happens, and there's 4 main aims to Valuing People. The first thing is loosely called personalisation, but what that means is that people get their own budgets from which they can choose to buy in the support, the care, and the opportunities or the work activities and such like that for them to do. The second aim is that people have jobs or meaningful activities that they can do during the day and in the evening. The third thing is that people have access to good health care and to be healthy. And finally, that people have more control and more say in where they live. So the aim was that there would be a point of reference for accessible information, and whether that be about activities that you can do or work that you might be able to do, whether that be paid or voluntary. Also there'd be information about direct payments, some questions. Lots of people have questions because when information is new, people invariably have questions they need to ask about it. So we've also got terms that have been explained. We've got a whole section about care providers, advocacy and various forms of support. And the idea was that we would make this all as accessible as possible. The website was made by a group of adults with learning difficulties and disabilities. The group's been learning how to do basic web design, how to do graphics, how to do filming, editing, post-production. They've learnt a whole range of skills. Even just in the collation of information has been a massive undertaking. And thanks to all the various partners that are out there, we've had lots of information that's been sent our way, almost too much. It's important that as you're looking through the website that you give us feedback on it. We want to know what's good. We want to know if we've missed anything out. We've done our best to make sure that we keep it up to date and current, but there may be things, because in this day and age things do change very quickly, there may be things that might be a little out of date. So do please let us know if you spot anything.